Welcome to the 5 Second Rule podcast. We are your hosts. I am Kelly Holmes, and my preferred pronouns are she, her.
And I'm Lerenza Howard, and my preferred pronouns are also she, her.
We've got a fun episode today with two dynamic guests who are sharing their projects from this year's National APIC Conference in Phoenix. I think our annual conference recap has become a bit of a tradition here on the 5 Second Rule. And honestly, it's one of my favorite episodes to do each year. So let's kick things off, and I'll introduce our first guest, Maria Vacca. Maria earned her BSN and Master's of Science in Nursing from Drexel University, graduating summa cum laude for both degrees. She began her nursing career in critical care. She transitioned to the infection control department in 2004. Infection prevention and control quickly became her passion. Over the course of her career, she's had the opportunity to provide oversight and obtain experience in numerous infection control roles, including high-level disinfection and sterilization, infection prevention oversight of ambulatory practices, and regulatory compliance coordinator. Maria's Lean Six Sigma training helped her lead numerous successful performance improvement projects for which her teams have won several awards, presentations, and publications. Welcome, Maria. We're happy to have you here.
Thank you. Happy to be
Welcome.
So, Maria, to kick things off, can you tell us about your project and what led your team to centralize the high-level disinfection process?
Sure, happy to. I'd like to say that this was occurred in the perioperative area. So these were endoscopes that were used during surgeries that were at the time being reprocessed in 3 different parts of the operating room. And what this led to was variation in practice, which of course increases risk. So we would be seeing in these 3 different areas staff who were assigned multiple roles, be it a nurse who was handling a post-operative patient or a tech who was supposed to be turning over a room in between cases, or so have you. They had multiple responsibilities, and now we're asking them to clean a scope, reprocess a scope, and high-level disinfect a scope that they may never have seen before, and they're relying on job aids or that they saw maybe once a year ago. So they in no way were experts in it. And everybody wants to do the same thing, right? To do the right thing. The staff want the tools, the time, and the resources to do the right thing. So the goal was to develop a consistent, compliant, and safe process where everyone was trained. We had dedicated staff and a dedicated area, and we gave them the skills and tools they need to perform high-level disinfection of these very important semi-critical items.
Maria, thank you for that, explaining you and your organization's project related to this initiative. And I'm pretty sure experienced IPs can hear some of maybe the challenges that could arise in this type of a situation. So explain to us, what were some of the early warning signs, aside from what you've noted, or challenges that made you realize that perhaps decentralization of the reprocessing of these instruments was a potential safety risk, and that there were some areas of opportunity related to efficiency?
Sure. So we realized that we needed to do something during rounds, our infection control rounds. We would look at semi-critical items that were being reprocessed, including endoscopes in all areas, including the operating room, which we're talking about right now. And we saw that many key indicators were not being followed, including things like documentation, missed soak times, improper storage, and we were seeing it more and more. Different teams in the 3 different areas were reprocessing things in different ways. It created inconsistency, and it created risk for our patients. A lot of times we were seeing point of use cleaning, not getting to the decontamination sink within the proper amount of time according to the instructions for use of that endoscope, which is usually about an hour. So we would see things that, because there was no reprocessing that happened overnight, we would walk into many scopes that were sitting there for, could be for hours. And then we had to do a delayed reprocessing protocol. And the staff might not be familiar with what a delayed reprocessing protocol was because, again, that wasn't their primary job. Even though staff were very well-meaning, again, always want to do the right thing, They're simply missing steps because reprocessing wasn't their primary role or their focus. So that's what led us. These rounds, we saw these sort of things, and we wanted to make a change for the better.
Ah, that's very good. It's kind of like the game of telephone, right? One person tells another person how to do it, who tells another person how to do it. And then, eventually things get lost in translation. And when you have that going on in three different places, I can see how that would be, difficult to standardize in all three places. So you mentioned in your presentation that you developed a business plan to support the capital request for this transition. That was really interesting to me. So could you tell us a little bit more about how did you make this case for leadership and really what factors helped you secure that buy-in?
Sure. So we presented the project as both a patient safety initiative and a smart operational investment, right? So our goal was to improve reliability, reduce variation, and ensure survey readiness. So to make the case financially sustainable, we propose using refurbished automated reprocessors. So at the time, we were opening a new hospital, and they were purchasing all new automated reprocessors. And a lot of our outpatient stuff, which was being done at the time in our inpatient operating rooms, moved over there. So we had these perfectly good automated reprocessors that were just going to go to waste. So part of the business plan was saying, hey, we have these machines. We can do some preventive maintenance on them, make sure that they're working and functioning. And that would take away some of the cost of buying all new machines. Because that was the other part. They were all using different outdated machines in the three areas. So this took away like the biggest capital expenditure from this project, which would have been the automated reprocessors, which can go for, like $100,000 a piece, and we needed several. Additionally, we showed how centralization would reduce costly rework. A lot of the times, like I said, there were these delayed soaking protocols that had to happen. It would be for hours at a time that they had to soak because they didn't get into the sink in enough time. So that rework and the potential infection risk. Again, I told you how these scopes are linked to infection. We show that data. And a regulatory risk as well. You can get many fines if they come around and see regulatory agencies come around and see that we're not following the IFUs and the standards and the guidelines the way we're supposed to be. So all of this, we were able to show a return on investment and an increase in patient safety and a decrease in risk. And we had some key leadership stakeholders that were our champions and were on all these meetings with us. And then I could just call and say, hey, we need this. So that really helped. So we had this timeline that we developed and meeting those key milestones for each. It was a year long for the business plan. We developed very key milestones that we had to meet over at a specific period of time over the year. We met weekly to make sure we were on target with this. And these leadership, senior leadership that helped us, they really had they were engaged, they had the buy-in. And if it wasn't for them, we couldn't have, they recognized the importance of this project. And they recognized that because of not only the business plan, but we could show them that it was much more of a flow. The staff were much more engaged because they were doing one job. And it was actually, the staff felt like they were adding to their resume, adding to their skill set. They were not, oh, we're just reprocessing. No, you're learning a new skill. Now, the staff may have still worked as a nurse or may still have worked as a tech, but the days when they were reprocessing, that's all they did was reprocess. And we were able to expand it to 24 hours a day, whereas before it was business hours. So scopes that are coming in on nighttime, we have night shift staff there. And there's kind of a clinical ladder where we encourage them within 2 years to get certified in high-level disinfection, again, adding to their professional resume and their skill set. So all around, it was very successful project and a buy-in from all the key stakeholders, from the patients who are right there at the the staff who are right there at the bedside reprocessing all the way up to senior leadership.
Maria, thank you for that. And really, your experience and the business plan that you and your colleagues developed really emphasizes the pertinence in having a financial acumen as an IP and, leveraging what you currently have and utilizing a fiscally sound approach in order to garner that buy-in from leadership. So that's a very important point to note and have in our experience as an infection preventionist. And you briefly noted the timeline of this project and some of the key milestones that were implemented. However, I do want to take some time for you to flesh that out. So what did the timeline, I know you noted a year, I believe. So what did the timeline and transition period process look like? And then also, were there any unexpected challenges? And can you explain those key milestones along the way?
Sure. Before I do, I just wanted to add one thing to the business plan. If anyone is thinking of, you hear a business plan and you're like, oh my God, that's so hard to do. You got to think even outside the box of things that you normally wouldn't think of. Oh, an SSI, we can show we had this many SSIs. We can't show they're related to scopes, but if we can even decrease one, that is a lot of money, right? And again, the regulatory fines, anything you could think of using the refurbished stuff. So I just wanted to say it's not as a daunting a task as it sounds. It can really be, it was really quite easy to show that there was actually a return on investment. So back to the timeline. Yes, we developed a detailed year-long timeline with clearly defined milestones to keep the project on track. Our team met weekly to review progress. We troubleshooted any issues that came up, and they came up. And we wanted to ensure alignment with deadlines and regulatory requirements. These regular check-ins were essential to maintaining momentum and accountability. And we assigned action items. So after each meeting, we would say, okay, Maria, you're going to meet with the reps to make sure that they're scheduled to do the training on this, this, and this. And Marissa Leahy was my IP, who was instrumental in moving this forward. She would meet with facilities to make sure that the plumbing was getting ready to transition the room over for the new automated reprocessors that we were getting. So they were key to minimizing, delays and to maintaining momentum and accountability. Key milestones included, as I said, the room itself. It was a refurbished room. We had to make sure that the flow was as it should be. So when you're doing decontamination and high-level disinfection in the same room, it has to be for an older building that the FGI guidelines allowed that to happen. So we had to make sure the airflow was right, that we were maintaining a dirty to clean flow, that every regulatory requirement was met, that the plumbing was a hiccup, getting those machines over, making sure that they were able to get to the temperature we needed to get. They were our key milestones. The room getting ready, the plumbing, the regulatory requirements and guidelines that we had to follow. Staff training was a big one. So they had to be trained on all elements of endoscope reprocessing, from point of use to transportation to decontamination to high-level disinfection, storage, and all of it. And again, the delayed reprocessing in case anything happened. What if what if all the machines go down? What is our backup? So that training, the initial training, the annual training, we had to make sure we were doing. Proper ventilation was very important, separation of clean and dirty workflows. We coordinated very closely with our team. So biomed, of course, the infection control department, facilities. It was really important that we were regulatory. We had to make sure that, we had a question, do we need this eye wash? Where does the eye wash have to be? Even architects, sometimes we had to get involved to make sure we were maintaining the proper airflow in case we had to change the airflow. The structure timeline was the key, I think, honestly, in meeting the goal of a year, because we said by here, we were actually a little ahead of schedule on some things, and other things we would fall behind. So that kind of balanced it out.
That's very impressive, Maria. I like the idea of the timeline, and then of course we know that things always come up and change, and you kind of have to pivot. But you accomplished quite a bit in a short period of time, which is very impressive. In your methods, you mentioned creating an electronic audit tool to monitor this new process. So, explain that to me so we can kind of picture that. What did you track, and how did that data really help you guide the education and continuous improvement?
So I'm happy to explain this to you. I love data. I just do. So as an IP, people will come to me and say, "Oh, they're not washing their hands on this unit," or "They're not low-level disinfecting on this unit," and I'll be like, "It's conjecture," So I will then assign my IPs to go do some electronic audits, and over the course of months, we can see the real data, right, and feed that back. So a key part of this was everything we taught them, the reprocessors now in this area, every critical element of the reprocessing workflow, from point of use, leak testing, manual cleaning, to proper use of the AER, the automated electronic reprocessor, and storage would be on the audit tool. And we were conducting, the IP team, we're conducting the audits weekly, and the staff received real-time feedback so that we could reinforce and correct practices. And they would see it wasn't punitive. We were just trying to say, hey, it's a new process. We're trying to re-educate, make sure you have every opportunity to ask questions. And that's why we're here. We're just here to support you. And you have to phrase it in that way too. It's not we're here because you're accountable. It's we're here because we want to support you. And we all, again, want to do the right thing. And we know you guys want to do the right thing. So that really helped. And over time, so we were started these weekly, we were able to not only give that real-time feedback, but over weeks and months and a quarter, we're able to say, hey, we see continuous issues in this one area. Maybe it's in drying the scopes. And we recommend re-education on a quarterly basis until we're at 100%, or some intervention that we would put in to get that part of the audit up. So using data to show where we needed improvement, drive that improvement, and show that we made the improvement. And then we ended up handing this off to the key users, right, the end users. So they're doing their own audits now in the operating room, outside the operating room, actually, where they are reprocessing the endoscopes used in the OR. The infection control team will still do it quarterly during rounds, just to keep an eye on it. So that really helped. It really helped show where that we were meeting what we needed to meet, and show where we needed a little improvement, and help tweak it and keep it where it needed to be, instead of a year later finding that everything fell out, right? So
Absolutely. Yeah, and that highlights the importance of course, many of us IPs, we love our data. However, you have to utilize it appropriately in the manner in which you and the team did in this situation, whereas it drove change. It drove, towards and led towards process improvement. But I do want to, just take some time to really emphasize that this was no small feat to really restructure the reprocessing of endoscopes and create this centralized model in a large academic hospital, right? So, of course, executing successfully change management, even, and bolstering staff engagement and obtaining their buy-in to this process, because the model of the reprocessing subsequently equated to, as you noted, fewer locations. You went from 3 to 1 location where HLD is performed, and then also fewer staff. You went from 40 individuals convening with high-level disinfection to only 9 that were reprocessing the endoscope. So I have 2 questions. Could you share how you engaged key stakeholders in the operating room to gain their support for this initiative, firstly?
sure. So we started with the why, right? Why do we want to do this? Well, for the staff who were doing multiple jobs, and reprocessing was one of their jobs, we wanted to communicate to them that we're just trying to make things safe and create a process where they can focus on their patient and not have to focus on the same time or day that they're focusing on reprocessing. gave others the opportunity to have a full-time job in reprocessing if that's what they chose. But when they would have to do reprocessing, or not have to, but there are days when they did reprocessing, that's all they would have to focus on. They wouldn't just be seeing it once a year. They would be seeing it routinely. They would be given the annual training and as needed training to do their job. And they have, one thing we didn't mention is in these 3 different areas, when staff were not sure what to do, or when quality controls weren't being done, or we would find something out of place, they didn't know who to go to. They didn't know who to escalate it to. A lot of times it would go to the wrong person, kind of fall on deaf ears because it wasn't the appropriate person, and it never got fixed. So they were happy to know they were being given the tools, the end users, and the skills they needed to do their job, one job at a time, not multiple jobs on the same shift. We knew we would only succeed with strong buy-in from our OR partners. So our clinical educator, John Carroll, was fantastic. Again, very instrumental in this whole project. He was saw the need as well and helped communicate during staff meetings, gain support with the operating room staff. So they understood what was coming and this new process. And again, the why it was so important. That's pretty much it. Once they understood, it's to streamline, increase patient safety, reduce risk, and give you the tools and the skills you need to do your job and the resources. Everyone was on board.
Yeah, that's absolutely key, is to share the why, and why that change management is appropriate, opposed to just, implementing a change. And then secondly, I wanted to, you to flesh out also what were the exact strategies used to train the staff and involve them throughout that process, and what type of feedback did they share with you all during this performance improvement project?
Okay. Yeah. So as I stated, and endoscopes are a very high risk device, patient care device, a big regulatory focus. So we got the vendors to come in, and they will come in annually now to do training. They did training, the vendors, for the specific scopes. Each specific scope, you have to follow the IFU. IFU stands for instructions for use. So you might have one scope that does point of use cleaning in one way, and then another scope that does it in another way. So we had the vendors come out and train the end user, say it was a urology scope, on how to do point of use cleaning on these urology scopes using the IFU. They would sign off and confirm that they understood, have the opportunity to answer questions. We then got vendors to come in on leak testing, on any sort of, I'm not going to do a brand name here, but any sort of decontamination aid. And so you're not having to flush all the scopes all the time manually. It's like an automated decontamination. Training on that. Training on the IFU from the scope manufacturers on decontamination and leak testing, very, very important. And then also on the use of the automated reprocessor. And all of it is the flow. Every one of them has to be met to successfully and safely high-level disinfect an endoscope. So all of that's very important. It's also, there's preventive maintenance that has to be done on all of this stuff. There's filters, multiple filters on one automated reprocessor. So they had to kind of learn to be the captains in there to see what the dates, understand the dates that certain filters had to be changed, know when certain tubing has to be thrown away, all of that. So I think your question was, how do we train and involve staff? We use vendors of the products to come in and use their IFU. And then we got staff involved by having super users or champions. So these were people who, if you hired a new staff, they could train them, and they could even do the annual training. And if there were questions in between annual review, annual education, these were the people you'd go to. And they were the people who, if they weren't sure of the answer, they would know how to find the answer. And that's how we got them engaged, by, again, giving them the tools, the resources, the skills they needed to feel confident to do their job and feel successful, and to even elevate some to the point where they wanted to train themselves and feel like experts in it. And again, it's another thing to put on their resume, their professional resume. We're all trying to grow and learn, and offering them that opportunity within 2 years to reimburse them for the HLD certification if they chose to, and encourage them to get the HLD certification if that's what they chose to do. Hope that answered your question.
It definitely did, Maria. And thank you so much for highlighting your amazing initiative to bolster patient safety and quality healthcare services within your organization.
Thank you.
And now we will pivot on to highlighting one of the oral abstracts that was presented at the annual APIC 2025 conference. Today we have Rachel Hyatt, who is a community health specialist with a master's in business administration. She's driven by a passion for innovation and process improvement with a strong foundation in infection prevention, administrative support, project coordination, and community engagement. She excels at transforming complex challenges into impactful solutions. As an administrative assistant with infection prevention for over 2 years, Rachel coordinated large-scale initiatives from accreditation surveys to system-wide health campaigns. Her diverse experience in customer service, animal control, and zookeeping has given her a unique lens on behavior, shaping her approach to public education and engagement. Her ability to merge strategic planning with creativity fuels her mission to develop engaging, effective solutions in healthcare and community wellness. She is passionate about leveraging innovative ideas and interactive outreach to inspire lasting, positive change. Rachel successfully submitted an oral abstract presentation to APIC's 2025 annual conference titled Wash Your Paws, Using Creative Canine Marketing and Therapy Dogs to Promote Hand Hygiene Compliance. Welcome to the show, Rachel.
Hi, I'm so happy to be here and even more excited to just talk about this initiative that I love so much.
Oh, Rachel, we're so happy to have you. I love your background and the experience that you bring to this project, and I can't wait to learn a little bit more about it. So, to start, can you tell us about the Wash Your Paws campaign and what inspired this creative approach to hand hygiene?
Absolutely. Starting with what inspired this initiative is a little bit of boredom, to be honest. As mentioned, I was an administrative assistant with infection prevention for 2 years, but even starting on, month 2, 3, I'm hearing about hand hygiene daily, and I can't even imagine how boring that might be for those, on the floor, not only having to talk about hand hygiene, but hearing others talk about it and doing the audits and the compliance and just kind of hearing that repetitious messaging can kind of just lead to a little bit of desensitization. So just kind of starting there is like, what could we do to make this a little bit more exciting or less boring? And so from there, we started with the idea of a new kind of initiative. And we wanted it to be fun, maybe exciting, and not boring. So what we started with was our mascot from Golisano Children's Hospital of Southwest Florida. What we started with was our facility dog named Lemon, and she's a golden retriever, and she's at one of the pediatric hospitals that we have. And her name is Lemon, and everybody loves her. So we took her and we made 2 different designs, and one of which is kind of her jumping through a banner that says wash your paws, and there's some bubbles on it. And then the second design we made is called wear your PPE, and it's still her, but she's in nearly full PPE. She has the goggles on, she has the PPE gown on, and then she has cute little people gloves, and it is honestly the cutest thing ever. And so we really just wanted to find something that people enjoyed and didn't find boring. And we're finding that people love dogs, mainly me. I love dogs. And so we were kind of banking on people already loving Lemon, loving dogs, kind of taking something that might be a little boring and kind of jazzing it up a little bit. And so that kind of turned into a multi-layered approach. And so it evolved into Hand Hygiene Day, and that is held annually on World Hand Hygiene Day or around it. and it includes interactive educational tables, and we host those at all of our 5 acute care campuses. And then we also have gotten some really great system-wide engagement and support to promote the event as well. And we also have printed the t-shirts with the design and we sold them at our uniform stores, and those completely sold out. Most of our staff can wear those to work. They are branded for most staff to wear. And on top of that, we also made the design into our rotating screensaver. So those kind of buzz around sometimes in the background.
This is such a cool project. I know one of the things that I, joke that I have in my mind is if you want to increase engagement, just add a dog to the mix. And I also wanted to highlight the fact that this is, you are a reflection of why it's pertinent to have individuals from diverse backgrounds in infection prevention and the initiatives related to IP and performance improvement. Because with your background in animal control and zookeeping, this was a very, successful, that we would discuss further, successful event that really increased engagement surrounding bolstering hand hygiene initiatives. So, of course, as you've noted, you all coordinate this around World Hand Hygiene Day. So what kind of activities did you include at the interactive tables, and how were the therapy dogs incorporated into the experience?
We had so many things. It was great. So to start, we took the design and we made those into stickers as well. So we had our teams wearing the dog shirts, super cute. We had the 2 logos on stickers. We also made those into coloring sheets. From there, we had some educational handouts. We had some Scooby-Doo snack, on theme crackers. And then we also had visits from our therapy dogs. On our first annual hand hygiene day, we had 14 therapy dogs attend our tables across our campuses, and they all took shifts. So it was just really cute to have all these dog images that people were wearing, the stickers, and then the dogs were there.
Oh, Rachel, it sounds like you've created so many fun and, just unique materials for this campaign. So you've talked about the stickers, you've talked about the t-shirts, the therapy dogs at World Hand Hygiene Day. And, how did staff respond to all of this?
Yeah. So to start, we began with the logo design. And from there, it just became a fun collaborative process of, we're starting with the t-shirt design, and then what can we make from there?
Rachel, it sounds like you've made some really creative and innovative materials for this campaign. And it sounds like maybe, you started with lemon and then, new ideas started pinging in your head to add to this campaign. So tell us a little bit about, how those were developed, and then how did staff respond to these materials?
Yeah, so we began with the logo design, which was really fun and collaborative process for both our team, myself mainly, and our digital creators. And from there, we expanded the concept to include t-shirts and then stickers and coloring pages. So it wasn't just the whole thing at once. It was definitely a puzzle piece. In each kind of step, we just kind of added something like, what if? And I think that just kind of brought it together, like the natural progression of things, that it just felt natural to add some of those items.
Oh, I love
hand
that.
hygiene.
Yeah. And so you didn't start off with this huge list of, okay, we're going to make stickers, we're going to make t-shirts, we're going to make, coloring pages. Like, you just kind of evolved over time. Is that kind of what you're describing for us?
Yeah. Once we did the t-shirts and we're kind of working on that, it was like, oh, well, what if we do stickers? Everybody loves stickers. We can easily hand those out. Oh, well, there's the children's hospital. What if we make that into a coloring page? So it was just so natural and easy to add on, like you mentioned.
Yes, easier to build upon your campaign. It wasn't quite as much of a big ask to, bite off all at one time. So I do like that progression. And so then, I'm sorry I interrupted you. How did the staff like it? What was the feedback?
Yeah, well, overall, hand hygiene can be a little bit of a difficult topic to make interesting sometimes. But I think by incorporating something that we kind of assumed that people love, we love dogs, that genuinely helped with a creative way to, just reimagine what hand hygiene education, participation, and engagement could look like because it was something that they already liked. And just immediately after the first wash your paws day, like staff were already asking, "Wait, when's the next wash your paws day?" And if we're just like thinking of that, of like imagine being excited about a hand hygiene event, like it seems a little odd, right?
Absolutely. And I think that that's something that, at least me, myself, and I love incorporating the fun aspects of IP. I know that, of course, what we do is very serious. However, increasing that engagement also equates to, making things more fun for and engaging for the staff as well. In your presentation, you did note that over 900 staff and visitors participated in the Washer Paul's Day, and that 96 were involved in coordinating the campaign. And that seems mind blowing, right? So, how did you organize such a large team, and what strategies or resources helped keep things running smoothly?
Yeah, so as far as tracking, I got very familiar with Excel spreadsheets very quickly, color coding everything, and just being very meticulous in the tracking because there was so many people as far as internal and some external staff that were helping us make some of these designs and products. So we just needed to just nail down a tracking system, which turned out to be Excel. And then as far as, making the execution a smooth process, we have great people in Lee Health, and everybody was so excited to help participate, get things going, that I think that also helps smoothline the process because people wanted to see this event and they wanted to see the t-shirt. So I think that the excitement and engagement from this initiative really also helps the participation.
Thank you, Rachel. And one of the things you kind of highlighted it earlier, it is that this, of course, it's pertinent to internally and within the organization shift the culture related to hand hygiene and advancing our practices related to that. But one component, additional component, is that this was also a community outreach initiative to advance education and awareness in the surrounding community. So share with us how this initiative spilled over into advancing your community efforts.
Yeah, so I know that some of our infection preventionists, for their goals this year, was to participate in some additional community outreach. And I have actually transferred into the community health and benefit team. So I am helping coordinate some of these external community events. And since I know how comfortable personally this shirt is, and it is Florida and it is hot here, this shirt is really well made and it's light, it's breathable, it's like a sun shirt. So I wear my own shirt all the time. So, creating that walking billboard of, especially externally, people really just are curious, like why, it's a Lee Health branded t-shirt with a dog on it. Like that's interesting. So we do get a lot of conversations, just a very natural curiosity of, there's a dog on your shirt. It's Lee Health. What's that about? And from there, it's just such an easy, casual conversation to talk about hand hygiene.
I love that. It starts the conversation in the community. Tell us about that cute dog on your shirt. Let's wash your paws. Yeah, and then you can do some education, which is so important. So, also in your presentation, you noted a meaningful improvement in hand hygiene compliance after the campaign. So, do you have any thoughts for us on sustaining that momentum over time, or any lessons or tips for others who are listening who might want to do something similar?
Yeah. So our first Wash Your Paws Day was on May 3rd in 2024. And we have a ton of hand hygiene audits, and we use an electronic audit tracking system. And so we have a significant amount of hand hygiene audits. So we are able to determine that between May and June, post the event, we had a system increase, compliance increase of 2.2%. And then that increase, it did slightly dip, but it's actually higher than before the event, which is really exciting. So
Yeah, that's
excited to keep it
fantastic.
going.
That's fantastic. Yeah. And so then, what are the tips for people who are looking to do something similar in this space?
Yeah. So my recommendations for others is just to always consider ideas, just big, small, new, different. My recommendations for others is to just always consider ideas that are big, small, new, and different. We started with a little dog, that we have, and all of a sudden, we have t-shirts and we have people excited about hand hygiene and we have therapy dogs. And it was such a beautiful initiative that came together that everybody seems to enjoy. And it started by thinking about a little tiny idea about what if we had a little dog, and it just blossomed into something that's just so fun, so engaging. And so just always taking the time to just kind of like pick apart a little idea, because you just never know where it's going to go.
Thank you for sharing your amazing project with us, Rachel. And I wanted to just also build a connection between, of course, Maria and Rachel's project as well. Of course, submission of your research is phenomenal and sharing that with the IP community and beyond. But then it also sheds light on leveraging your internal resources in order to bolster patient safety initiatives internally. So I thank you both for sharing your experiences, Rachel, Maria, and how your organization you leverage those internal resources, but also worked to advance quality healthcare services as well.
Yes, I echo what Lorenza said. I am so grateful for the work that you both have done in this space. Both are innovative and creative in completely different ways, and you really show your strengths with leveraging your teamwork within your organizations. And so, really, thank you for taking the time to be here with us today and tell us about your work.
Thank you.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.